Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I'm a cardiologist from Houston, Texas, and today we're going to talk about diabetes mellitus, not travel trips, but breads. Let's focus on breads, diabetes and breads, low carb, high protein, gluten free. Are these facts or just myths? So let us look at certain examples and see what we can learn from this presentation. So let us jump right into the main presentation. Okay, ladies and gentlemen, let's jump right into the main presentation. Diabetes, you can follow my green arrow here. Diabetes, breads, low carb, high protein, low calorie. Are these facts or just myths? Well, we'll uncover that in this presentation. There are a lot of breads that are being marketed to reach certain target audience like heart patients, especially diabetes patients or patients with hypertension. The main thing is low carb, which is a very fancy term, or keto friendly. You might have heard these things. And the fact is, do they really meet any criteria such as low carbs or keto friendly? Because if you look at it, the keto diet recommends no more than 30 grams of carbohydrates per 24 hours. But when we go through these various breads, you will see how quickly you can add up your carbs with just eating a few slices of bread per day. Okay, let's start off with the so-called high protein breads. Let's look at them. Quinoa bread is supposed to be high in protein. All these specialty breads are almost like $4 compared to $1 you pay for a regular loaf of bread. But keep that aside. As you can see, these are big slices to start with. There's 36 grams total weight, 90 calories, very little fat, which is fine, very low sodium, which is good, 17 grams of carbohydrates. So you still have 17 grams of carbohydrates and only 1 gram of fiber, but so you still have 16 grams of carbohydrates. That's not a small amount for people who are on diabetes or people who are on keto friendly diet. Of course, you get 4 grams of protein. So whenever you look at a product, pick up 2 or 3 items, put them side by side and compare these numbers. Or better yet, do research like I do. Just sit at Google search, bring up these items, put them in a PowerPoint presentation like I have done, and put them side by side and see what sense they make. Let's move on to the next item here, which is rye bread. Rye bread has been promoted as good for people with diabetes. And here are some of the statistics. Rye bread tastes great. I have used rye bread for making toast or for making a Reuben sandwich, which tastes delicious, especially if you toast it on both sides with butter. Anyway, let's get back to the contents here. 80 calories, 32 grams per slice, 1 gram of fat, 170 milligrams of protein and 3 grams of protein. So the protein is not a real big amount as you expect, but you still have 14 grams of carbohydrates. So these are not low carb breads. First of all, their sizes are huge compared to a regular loaf of bread slice. And of course, they do have sodium and no cholesterol here. They have 3 grams of protein. So I said you have to be an intelligent consumer to know what you're getting. The bottom line, as far as I can tell you, is going to be an important tip, which I'm going to tell you at the end of this presentation. And stay tuned and let's continue with seeded breads. There are like flaxseed breads and walnut breads and all kinds of nuts added to increase the protein content. Again, of course, the fancier the name, the more expensive the breads. They can range anywhere from $3.99 to $6.99 per a loaf of bread. So keep that in mind. This is a smaller slice, 28 grams, 70 calories, which is not bad. 13 grams of carbohydrates, which is good, but only 3 grams of protein. It's not like it is rocket science where they are flooding this with protein. So when you read all these things, low carb, high protein, diabetic friendly, keto friendly, you need to be skeptical about, are they really telling the truth, or the proof is in the nutritional chart? So that's where you need to go. Don't listen to what they say. Don't watch what they say. Just read the labels. Read my labels. Okay, sourdough bread is very, very popularly promoted as a bread for diabetes patients. So what is special in this? First of all, the slices are huge. Look at that, 43 grams. It's almost equal to twice the size compared to some of this regular loaf of bread. And it has very little fat, 200 milligrams of sodium, 20 grams of carbohydrates. So it's not low carb slice of bread for diabetic patients. It has 3 grams of protein. So not a big difference as far as you can see. So the bottom line is, what is your aim? That's the key thing. If you want to keep your carbohydrate intake to 10 grams or less per morning breakfast, then you can look at any one of these breads and just slice them in half slice and just use half the slice. Of course, you're getting lesser protein, lesser salt, but that's the key to keep your carbohydrate low. That's the key to keep your calories low. So those are some of the important facts. So that is more scientific than looking at these nutritional labels and trying to become like an expert in trying to feel great. And here are some specialty breads. I like this Italian round bread, and it tastes great. It's huge slice again. That slice has to be cut into 2 pieces before you can put it in a toaster. But look at it, it's 52 grams per slice. Man, but it tastes good. I have been using it. And now after looking at this label, I am a little bit skeptical because 320 milligrams of sodium, 27 grams of carbohydrates. Yes, you get 4 grams of this one. So if I were to use this bread, I may have to slice this into half and use only half the slice, which will sort of serve the purpose of having a nice bread that you like, that you can enjoy, but make sure the other half is saved for lunch or for mid-afternoon snack. So don't use the whole 2 slices that you put in a toaster, because this is a huge round bread. And this is one more item I want to talk about. The Rustic Italian, this is one of my favorite ones. It is just like in a restaurant where it's like a thick, crunchy bread where you put a lot of butter. I mean, of course, in a restaurant, we don't have proper mind. We just put whatever is tasty and eat it. But let's look at this one slice. This is not a big slice to begin with. It's 56 grams. Ooh, yeah. 120 calories, 0 fat, 270 milligrams of sodium, 25 grams of carbohydrates. So if you like specialty breads, which is fine, and this one is like $3.99 in Kroger, and I buy this from time to time. So, but I have to modify what I'm doing now, because I don't think I should be eating a whole slice, because I'm getting 25 grams of carbohydrates. So that's a lot more than what you want to if you want to bring your sugar level down and if you want to keep your calorie intake down. So the key is moderation. So ladies and gentlemen, by looking at this whole presentation, I can tell you I have learned a great deal, because I have been using that the Italian round loaf and rustic Italian bread, but I've been eating twice the quantity as I'm supposed to be. And that's how we learn from doing things. We learn by looking at labels. We learn by comparing labels. We learn by doing mistakes. So I've done my mistake. At least by preparing this presentation, I have decided I can continue to enjoy those tasty foods which I like, but only thing is cut it into half. So if you cut your intake by 50% carbohydrates, I think it solves a lot of problems. It solves your problem with your diabetes, sugar levels. It solves problem with your calorie intake. It helps you to lose weight. It helps you to lower cholesterol, and it helps you to become a new person. Think about it. Think about it and cut your carbohydrates intake by 50%. And all these labels, they pretty much read pretty much same. It's a matter of quantity control. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel, and I will see you in the next video on health tips.